Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel and welcome to return of this amazing segment, the Q&A segment, where all of you viewers get a chance and an opportunity to ask me as many questions as you have. That's right, as many questions as you have. A lot of you have been emailing me asking me if it's just one question. No, it is not. You get to ask as many as you want. To participate, all you gotta do is email me your question or questions. My email is below. It's basically info@drzphd.com without spelling it, drzphd.com. Make sure you keep it brief so that way it's not too mouthful for the segment to be utilized. And what I do is I put all of the questions in a folder and then I randomly select 5 for each week. And rest assured, if your question doesn't get answered this week or next week, it will get answered because I go through the folder until every single question gets answered. So your question definitely gets answered. So if you do have questions for me or questions, make sure you email to me. I'd be very, very excited to provide you with some guidance, tips, and in the very least, some insight based on my experience. As always, I use everybody's name and email addresses and any of that information blocked out, so it is completely confidential and private in case if that's a concern for you. And I will flash out question on a screen so that way you can also all read along as I go through the questions. For today, I randomly selected 5 and I'm very, very, very excited to get started. So without further ado, let's get rolling. Question number 1 for today. In what way can obsession/fixation with things feminine, especially clothing, heels, lingerie, etc., the female form and beauty since before one's teenage years lead to formation of desire to be fully female and passing to having trans femme identity? This is a really, really good question. This is question that a lot of people, when they reach out for the 15-minute phone consult that I offer with me, which is, by the way, link is below too, tend to ask me to what extent their preoccupation in childhood or early age with feminizing items, it actually leads to, how much of that it actually leads to trans femme identity. And whether one feminizes for just pleasure, for sexual activation, for just because it feels good, doesn't really matter. It doesn't really matter what is the purpose or what's behind feminizing, because everybody has their own personal reasons and they're all very valid. But what a lot of you tend to wonder and ask me is that to what extent can that then lead and become trans femme identity? What I can say from my experience is that individuals who had this preoccupation early in their teens, throughout their adulthood, and later identify as trans femme, there are potentially 3 explanations that I have found throughout my decades of experience. Explanation number 1, those individuals were always trans femme and they weren't really aware until later at age. In this way, the preoccupation may have existed solely by itself because people who had desire, predisposition toward it, and ran alongside an already innate trans femme identity. So group number 1 are people who were already trans femme, but were not aware of it. The second group of individuals are individuals who are trans femme, where at some point maybe even somehow semi-conscious of it, but for whatever reasons, maybe environment, maybe family, maybe personal upbringing and feelings of shame and guilt, repressed that identity, and therefore the externalization and the obsession, this fixation on very feminine things, including female form and beauty, became a passageway, became a doorway, became a permission slip to engage in something that internally strongly resonated with them in order to further continue to be in a state of denial and repression. And the way that it works is that a person will engage in the feminine activities and they will start telling themselves a narrative that all it is an obsession, a fixation, and has nothing to do with being trans, because they're not ready, they're resistant, they're not ready to acknowledge they're trans. So again, group number one, preoccupation exists alongside already having a trans identity, but you realize you're trans later in life, and this is just something that also stemmed from it. Group number two, people are using preoccupation with feminization as a way to avoid confronting and accepting the reality of their trans identity. Now, group number three is the one that I find how should I say it? It's a combination of social factors and interpersonal inner factors that will lead to a person to develop a transgender identity that seldom I hear practitioners talk about. And that is when a person doesn't necessarily have a transgender predisposed identity, may even feel very comfortable with their assigned gender, but have this innate desire. Often higher percentage, I would say, people engage in feminizing because there's a sexual link to it. Nothing wrong with that. It's so important to stress it out. But they engage in it because this is their sexual preference. Just like so many people have different sexual preference, and people have sexual preference for kink or BDSM, and people have sexual preference for the most out there vanilla sex. This is one of those sexual preferences for individuals. And so because it's sexual preference and it feels good, but yet an individual cannot fully also accept that this is part of their sexual landscape, not gender identity landscape, but their sexual landscape. Because again, they grow up in a time when it's taboo, or they grow up in a times where it is shameful. And as a result, what happens is that even though they're very comfortable with their assigned gender, what happens is that every time they feminize and get sexually aroused and get pleasure out of it, what follows the pleasure, and I talked about this channel many times, is a cycle of this feels really good, and then after you get an orgasm, you start feeling shame and guilt, which then makes you start asking yourself, what is wrong with me? Why am I engaging with this? Because shame and guilt, anytime we feel shame and guilt, oftentimes we turn it inwards. And the first question we tend to ask, by being very punitive and very critical of ourselves, is what is wrong with me? So when this continues from teenage years all the way into adulthood, and you're constantly asking yourself, what is wrong with me? What is wrong with me? What is wrong with me? What happens is twofold. On one hand, you are you are blocking the unfoldment and solidification of your assigned gender with which you are comfortable, because by questioning what is wrong with me, you then further go down the path of asking yourself, if I engage in this behavior, then I'm probably not really a guy, I'm really not a man, I'm really not a boy, something must be wrong with me, maybe I'm a girl, maybe I'm a woman. And when you're very young and you don't have any understanding what's going on, you really start to kind of create the split narrative inside of your head, which again prevents solidification of your gender identity. And as a result, your assigned gender at birth and relationship to that identity never gets fully solidified. And what happens is that eventually an unfoldment and emergence of a trans femme identity. Now, in this third scenario, again, nothing wrong with that. You have to all remember, as human beings, throughout our human development, we're constantly unfolding, we're constantly shifting, we really are like a piece of Play-Doh. We're very malleable. And a lot of our experiences influence things and shift our maybe even innate predispositions, shift some other things within us. This is all just called being human, going through human life experiences. So there are individuals who started out where this was just sexual preference, But with some time, it actually shifted in the formation of trans femme identity, or I would say more formation, maybe not the right way to say it. What happened is that I would say individuals got to the point where they feel now more aligned and more comfortable living a life as women than living a life as men, because that identity never really got to solidify. Okay, so but yeah, the obsession and fixation with things can definitely kind of not lead to, it's not like a clear correlation, right? You have to be very clear about that. It's not because there's a lot of kids who gender bend. There's a lot of kids who and kids need to gender bend, and we all need to gender bend. And just because somebody has preoccupation with stereotypically gender specific items doesn't necessarily mean that they're going to later on in life develop any particular gender identities. It really comes down to a lot of factors, including how long it lasted, the nature of the preoccupation, as well as what kind of scripts you were running, because a lot of people engage in this behavior, engage in the sexual practice, and they don't feel shame and guilt. And so as a result, they continue to grow up and solidify their gender assigned at birth identity, and at the same time continue to have the sexual preference where they feminize, and sexually it feels really good. And the two coexist, and they don't have any tension or any kind of disalignment with it. So we've got to keep in mind that this is not like, oh my God, I'm just thinking in today's era, people just take everything as very polarizing. This is not a case where we have to prevent all the boys from having fun in gender bend because, oh my God, they're going to end up being trans adults, which, by the way, nothing wrong with forming a trans identity. So it depends on a multitude of factors. But often than not, people also have an underlying current of a gender identity that is already not innately even meant to be very binary. So this is a really, really good question. And I have a video where I believe I describe all of the categories, and I talk about it in much more in detail on this channel. So make sure you check it out to get more information. Question number 2. I believe I have heard you advise not to use hormones as a way to figure out one's gender identity, but also that it is okay to start hormone treatment without being absolutely sure you are trans. Can you help me understand the distinction or correct me if I have something incorrect? This is really, really good. And it's a really good question because a lot of times when things are presented, things can be taken out of context, things can be misunderstood, especially when I put out a lot of the short form, 1 minute real content that is not situated in the long-term content. So let me clarify. So hormones are really, really great for people who want and need hormones, feel ready to start hormones, and in that case, hormones become a great way to affirm one's identity. To affirm, it gives that affirmation boost that you are on a right path. Hormones are also really great, and I think this is where I may not have been spoken very clearly. I need to speak more clearly. Hormones can be really, really great for individuals where it's not that they're not sure about their I'm finding a way to make it very clear. If a person has a strong, not even strong, but if the person is pretty aware that they're trans, that they're either trans femme, trans masc, non-binary, but yet they still have uncertainty. If that uncertainty is tied to external factors, because remember, uncertainty can break down into multitudes. There could be, I am not sure if this is my trans identity. If this is your uncertainty, if you're not sure you're trans, hormones is not a clarifier. Because especially female hormones is a good feel hormones, it's going to make anybody feel good. It's not a clarifier. But if one feels I'm trans, but I'm uncertain whether hormones are going to benefit me going to alleviate distress, going to make me feel better, hormones is a great way to start, especially feminizing hormones, not masculinizing hormones, because masculinizing hormones can produce changes really, really quickly versus feminizing do not. For that reason, feminizing can afford people a little bit more flexibility to play around with. So feminizing hormones become really, really good to start, to see, to explore if it makes you feel better. And also to affirm that you are on the right path. There's difference between I need to affirm what I already know versus, so this is actually a good way to put it. Again, I need to affirm what I already deep down know about myself, potentially it could be hormones, or I have no idea who I am, and I think if I take hormones, they will tell me, okay? In this case, I don't recommend hormones. I never recommend any medical, surgical for anybody who doesn't know who they are, okay? If you don't know who you are, medical, surgical, in my opinion, should be the last resort. Because why are you stepping into something that is irreversible when you don't even know? In that case, what you really need to do, what anybody needs to do, is to explore more. But if you do have your own knowing, if you do know, but you're still like, a lot of times we know, but we just need that affirmation. Or we want to see how, if it's going to actually benefit our most important psychological health, then yes, hormones, especially feminine hormones, are a fantastic way to go. Great question. Hopefully that clarified for many of you, and hopefully that made it very, very clear. Again, if somebody's completely unsure if they're trans, hormones they're just going to lead to confusion. They're unfortunately, hormones are not one of those things that you take and then you go, oh, that just tells me who I am. Because like I said, especially feminizing is a feel-good hormone. Very, very good question. Question number 3. My question for you is, do you have any advice for keeping motivation and spirits high on the long run? I found it to be difficult to be consistent with daily transition steps like working out, using an at-home IPL device, etc., especially when dysphoria fades. Because while it's clearly there, it's painfully motivating in a way, like toxic motivation, but whenever it fades, a false temporary sense of things are okay now sets in, while things really aren't okay yet. If things were okay, then dysphoria wouldn't come back swinging. This is really, really good question, because I know for a fact so many of you are in this position where you, especially mid transition points, for those of you who are in transition, where you are in this place where there's just no motivation. How do you keep going? What do you do? And just like this person pointed out, yeah, when the dysphoria is present, it does become like a toxic motivation, because that pain point pushes a lot of you to do things, pushes a lot of you to propel back. Because as humans, we want to seek pleasure and avoid pain. That's just natural, right? That's just very, very Freudian for all of us. So it's very natural to want to avoid any kind of share of pain. But what happens when there is no pain? What happens when you actually feel great? How do you motivate? Well, I would encourage you first to recognize that feeling great should be a motivator, right? If you're feeling great, if everything is going well, that could be a really, really, really good motivator. But how else do you keep motivation and spirits high on a long run? My advice is, it's very, very important, and I think this is something that a lot of people tend to underthink, tend to not really think through. Transition, in fact, I don't like the word transition because it implies beginning and an end. An evolution into who we truly are is a lifelong process. I'm constantly evolving into the person I was meant to be. You're going to constantly evolve. Gender is going to be a big part of that evolution for all of you. And there's going to be certain milestones in that evolution that are going to come to an end. Perhaps some of you want surgeries, and when you complete the surgeries, that's going to be a milestone that came to an end. perhaps facial hair removal is going to be a milestone that eventually does come to an end. Voice training is another one. Top surgery for masculine individuals is going to be another one, right? So there are going to be definitely milestones that will have a closing chapters, but there's so much about an evolution of yourself and your relationship to this authentic part of you that has not been actualized and have not had opportunity to live. That evolution is going to be lifelong. And so it's incredibly important for all of you to see your evolution as a long-term game. Look at it as, I'm in it, it's like ride or die, right? I'm in it for life. Because what you're really doing is that you're committing to yourself. It's a commitment to yourself. It is an investment in yourself. It's a lifelong endeavor. It is just like anything else that's really important to us in our lives. If a healthy lifestyle matters to you, if eating healthy and exercising daily matters to you, are you going to do it just for 5 years? Hopefully not, right? Hopefully you're going to see this as a lifelong thing, because you're going to remind yourself of all of those things that you benefit as a result of engaging in it. Same thing with this. So what's going to help you keep motivated is, first and foremost, keep reminding yourself that you're in it for the long run. Keep reminding that this is ride or die. This is you living your life, and sometimes living your life is going to be hard to push yourself to do those things that are all going to be really, really important to you. Another thing that I find motivating and that helps a lot of my clients is to have a vision board. Vision boards are incredibly powerful. Being able to send visual imagery to our brain to hold on to be able to have a vision board that you can then just pull up on your cell phone anytime you feel unmotivated, anytime you feel down, and just remind yourself where you're headed is incredibly, incredibly powerful and very, very helpful. So if you haven't had a chance yet, create a vision board. Vision board is basically, you can do it on Pinterest. It's basically images that speak to you, that are a compilation of variety of images that compile to create a schema of how you see yourself in the future. I used to have a habit, actually now reminded to do a vision board in the beginning of every year. So as a new year rolls out, I would do a new vision board of my future goals. What do I want to bring in this year? And that would anchor my entire year. And anytime I would feel down, I would pull it out and look at it. So a vision board is very, very powerful. Last and not last, be connected to a person or people that inspire you. I'm not talking about following gazillion transition accounts before and after, but is there somebody, it doesn't even have to be a trans person. Is there just a person there that really motivates you to keep going, motivates you to reach your goals, to achieve things that are so important to you? For example, there's this woman, and she is missing an arm, and she is in a very heavy resistant weight training. It's amazing what she can do without an arm. And when I see her, she motivates me that nothing is impossible. And I follow her on Instagram. There's a little kid that has spinal burst defect, where his father is helping him every single day. That little kid motivates me. Find accounts that motivate you, where you can see people doing amazing things that otherwise would be considered impossible, to remind yourself that you can too do what you feel is impossible. My last final thing for this question is, don't wait for motivation just to suddenly step up on you. I had a video talking about it. This idea that motivation is going to happen, it's going to come, is the biggest, I think, American selling BS that we ever all got sold on. Therefore, a lot of us just wait and sit and wait for motivation to come. Motivation doesn't come. What comes is you start doing what you want to do, And when you continue doing it, once you start seeing benefits and rewards and improvements, that motivates you to do more. So it's the results of our hard work that then becomes motivation to keep us moving forward. So keep that in mind. But great question, and hopefully that was helpful. Question number 4. What can you do if your spouse at work and a bathroom bill or workplace policy limits restroom access? How can you navigate this in practice? This is such an important question for today's times. For those of you who are not familiar with the word stealth essentially is a person that clearly passing for their goal, have no problem passing for their gender, and also living their life as the gender without disclosing or being open about their transgender history. Although they can be open if they're asked, but they're not outwardly explicitly open about it. So what can a person who stealth at work and a bathroom bill or workplace policy limits restroom access? So I'm gonna give my kind of personal opinion. Keep in mind this is personal opinion, and it might not be for everybody. If I'm gonna answer this way, if this were me and I was in this position, the first thing that I would consider is what is a potential consequence I may run into if I use the bathroom, and it seems like if this person is living stealth, this might be a very big if for some reason somebody points out that I'm trans or whatever and I can't use the bathroom, what is the consequence? Now in some states the consequence is a guard is just going to come and tell you to use a different bathroom. Okay, the consequence might be where you live is that you're going straight to jail. Consequence could be that you're suddenly subject to violence and harm. So first look at what the actual laws are, what might actually happen. That will give me, at least if I was in the situation, an indication of what am I stepping into, because I think that's really important to consider. Second of all, either at all gender neutral or family bathrooms at work, that would be something that I would go and use first. And third and foremost, I personally, it's kind of ridiculous, right? Because if you're stealth, you're gonna look silly in the other bathroom. At the same time, if you were to use the other bathroom, which is just gonna make them all look silly and stupid, you're outing yourself, right, to your whole workplace and work environment. This is one of those places where there's no win-win. It comes to a personal place of balancing the potential consequence of the actions, if something does happen, together with potentially, can you just say screw this and just out yourself? And in this case, it becomes a very personal thing for you to consider. But this is a tough one. I personally not going to recommend anybody to just suddenly become big activists and rebel against this. You can, of course you can, everybody can do this, but I think becoming an activist is a very personal thing. And I think that I also don't think that everybody has a tendency for that, or I would say doesn't have predisposition for that. So it's a tough one, but that's what I would do. I would see if there's a family bathroom first. I would see if there's gender neutral bathroom first, which probably not, but at least family bathroom. And if there are none, I would look at the consequences. And if I wasn't ready to out myself, I would just continue using the bathroom that is aligned with my gender. And just, you've been using it all this time, right, at work, and nothing has happened. So just because there's now a bathroom bill at your work, how's it going to change, right? So I think those people who let's be clear, it's women, right? I have yet to see men being upset about trans men in bathrooms. it's always women bathrooms that seems to be an issue. And I feel that the women who are so preoccupied and concerned about trans women coming into those spaces are really women who carrying some trauma and wound issues, maybe even wound issues, unhealed trauma against some male experiences they had with men that they need to heal from versus projecting it on the rest of the other women. And usually those women, they're so paranoid about gender, they're so paranoid about everything else that it's just really silly. Sorry, I went on like this tangent because I just think this whole women targeting women is. Let me just say that no woman out there that is assertive and comfortable in her own skin, cis or trans or any kind of woman, is ever gonna give shit at all about other women of any kind in bathroom. Okay, that's just a fact. So yeah, just think it through. But hey, you've been using it all this time. I'm not sure how this is going to change much for you. But yeah, think about the consequences first of your state. I mean, you don't want to end up in jail. That would be not good. And considering that a state that puts people directly in jail from violating their bathroom bill, most likely will put you in like an all male cell, and I think that would put you quite at risk. So that's something to think through. But it's a personal thing, and this is becoming such an issue for so many people. Such an issue for so many people. So yeah, if somebody else has any comments or input for any of these questions, please do share them below. Like on our last video when I was talking about food dysphoria and this person struggled with finding good looking shoes or designer shoes that are made for bigger feet. A lot of you have shared so many great resources, so please do share them below. Good question. And the last question for today, question number 5. Do you have any tips for hair removal? I have a lot of thick, dark body hair, and shaving and even waxing leads to painful and HRT growth with tons of ingrown hairs, and the body hair is my biggest source of dysphoria. Yes, I do. I do have a tip for you for hair removal. So my tip, and this is actually a tip that I learned from an electrologist who works with a lot of my clients. So this is not just coming from me, because clearly I don't do electrolysis or I don't do laser. But my electrologist shares with me that for individuals who have especially very dark or just dark body hair, laser is definitely a way to go. Laser is going to be way more inexpensive than electrolysis. It is also, for a lot of people, is going to end up being permanent method, and it's a great way to get rid of majority of the hair. And then she says whatever is left or whatever is not being able to be targeted by laser, get electrolysis then. Now, I had personal clients who had laser both on their face and both on their body, had all of it taken care of, never even needed electrolysis. It's really going to depend on a lot of factors for you too, but laser is definitely a way to go, and it's way cheaper. So it's definitely a way to start. A lot of people also have been using at home laser type of devices that are designed for people to use at home, and also have been successful. I think it's going to depend on the device. It's going to depend on, again, your hair type. If anybody has like a really good success rate with the device you've been using, share it below for this person to see. Yeah, laser is going to be definitely your way to go, and I agree. Shaving doesn't last long. I know. I mean, I shave my body hair, shave my legs, and it's pain in the ass. Waxing, yeah, wax, depending also on the type wax that the person is going to use, how good they are, unfortunately does lead to itchy regrowth, and it's really uncomfortable. So laser would be my recommendation. Way cheaper and way more efficient for darker hair. So hopefully this is helpful. Great question. These are all fantastic questions. I'm so grateful for all of you who have asked me these questions. If you have questions, don't hesitate, email me. very, very excited to do the next one for the next Friday. Hope you all have a wonderful, wonderful day, and I will see you all in the next video. Goodbye.